Evidence suggested by the author explained that the sole purpose of this investigation is to study the attitudes of clinical psychologists who work with cases that have to do with prisoners who will be examined with personality disorders. Working with these prisoners has been shown to have multiple variables that will show whether it influences a percentage of personality disorder clients on clinicians' caseloads. Clinicians' attitudes arise from a complex mix of factors including clinical training, their own values and biases, and ethnicity of clients and clinicians have highlighted this complexity, suggesting that there are many factors embedded in the shaping of attitudes towards patients diagnosed with a personality disorder, as well as attitudes being expressed by the staff is what also is suggested in order to understand clinicians' attitudes to clients with personality disorders that must take into account the amount of exposure clinicians have to this client group. The aim of this current study is to explore clinical psychologist attitudes to working with patients with a personality disorder. This information that the author results from can formulate a clear understanding of how the clinical psychologist feels and how the events are or can affect their lives. The authors have shown through their research that attitudes to personality disorder questionnaires were given to those being evaluated over a 3-month period, where participants in Australia were recruited through advertisements. Also known as the APDQ scale, consisting of 5 variables: 1, enjoyment, positive feelings towards patients; 2, security, feelings of safety and lack of anxiety; 3, acceptance, absence of anger, irritation, and alienation from patients; 4, purpose, a sense of meaningfulness in working with patients; and 5, enthusiasm, a sense of energy. In total, there were 81 surveys completed online, and 69 were from females, which was 85% of those questions, and 12 were male, which was 15% of the rest questions. In essence, the results all varied from different aspects, of which the authors found that patients with a diagnosis of borderline personality disorders receive significantly less empathy from nurses than patients with other diagnoses. Also, the nurses demonstrated more negative attitudes toward this group of patients questioned in Australia. Another source cited by the authors also suggested that out of the 229 mental health staffs, including 15 psychologists on experience, knowledge and attitudes towards patients with borderline personality disorders were trained in courses for practitioners in this specific case. Furthermore, a range of variables including types of treatments the prisoners received, knowing more about prisoners' background, adequate supervision, and a cohesive working environment were all associated with positive attitudes. Negative attitudes, as indicated by the total score on the APDQ, were associated with perceived prisoner behaviors such as manipulation, attention-seeking, and self-harm, in addition to the structure of the unit and lack of training. However, the APDQ was only moderately effective in predicting attitudes among staff working with personality disorders over time. The result of another investigation states that the aim of multiple effects that clinical psychologists go through within a 20-hour dialectal behavioral therapy training program, which was delivered to nurses, psychiatrists, and social workers in rural Western Australia, had discovered a significant increase in knowledge and positive attitudes and decrease in burnout, which can be questioned with other sources. The point that authors are hoping can be revised as a result of the information not being specific enough is the fact that the APDQ only assesses attitudes to personality disorders in general, and did not focus on specific types of personality disorders such as borderline personality disorders and how the types can be seen as an independent variable that can be a possible cause of no burnout or no stress in further research.